Now, today I wanted to talk about wet macular degeneration. I've talked about the dry macular degeneration in the previous video, and today we're talking about the other form that people hear a lot about. So this is a less common form of macular degeneration, and usually you'll develop it if you already have a background of dry macular degeneration. So, you're already kind of monitoring your vision for changes, and then all of a sudden you'll notice a change. You'll notice increased blurring or distortion in the eye, and you'll become aware of this. Sometimes it is out of the blue. If you're not aware you've got this background, slow, dry macular degeneration, slow age-related changes, because not everyone has symptoms with that. That's a very slow condition to develop. So it may be quite out of the blue for you. Um, what is the condition itself? Well, what it is the layers underneath the retina at the back of the eye, which is the wallpaper inside the eye, and the layers underneath that are rich in blood vessels to supply the retina with blood and nutrients. And sometimes you get little defects in the sort of bottom of layer of the retina, and you get the growth of abnormal blood vessels from the bottom layer upwards through these gaps, through these defects. And these blood vessels, they can leak, they can bleed, and ultimately they distort the retina and they reduce its function so that your vision gets blurry and things start looking wavy and bent out of shape. When you notice this, if you get diagnosed quickly, we always recommend quite prompt treatment for this condition. Uh, we used to struggle to treat it, but nowadays we've got very effective drugs which work very well. They're called the anti-VEGF agents. And what they are is they contain an active ingredient which inhibits, stops the growth of these abnormal blood vessels, makes them shrivel up and shrink. And so you reduce the leakage, you reduce the bleeding, and you give the retina and the macula a chance to recover. And these anti-VEGF agents have different names. There are drug names, such as ranibizumab, bevacizumab, and then there are trade names for the same agents, such as Lucentis and Eylea, and lots of others nowadays as well. Um, these drugs need to be delivered through an injection into the eye. And lots of people aren't keen on this, quite understandably, but actually delivered properly with good anesthetic, it's not too onerous a procedure. It's very quick, it only takes a few minutes, but the injections do need to be delivered at regular intervals. So if you do get diagnosed with this condition and you get told that you need a treatment, it'll usually be several injections at monthly intervals. And after that, we try to extend the treatment to see if we can increase the gap between the injections. And if you've gone for a time with good stability and improvement, then we can sometimes stop the injections after a year or two, typically. Now, it's a worrying time and it's a burden to come for the injections, but actually the drugs are effective. Um, they maintain the vision, they can improve it, but also they slow down the progression of the disease right down so that we hope to avoid significant visual loss. So it's a great treatment that we have, but it's important to discuss with your ophthalmologist the implications of it, the timing of it, and the rationale for the treatment.